If I had an ethical concern with a colleague, I would approach the concern with that colleague in particular and keep the matter confined to one-on-one discussion with that individual. And if not resolved there, maybe bringing it to a supervisor or management for them to handle. Now, when faced with a situation where my employer is asking me to do something that I feel is unethical, I would begin with consultation with other experts in the field that would be outside of the situation. And once I was able to get confirmation that my ethical perceptions were justifiable, I would proceed in meeting with the supervisor or the employer, requesting that they do not um, enforce me to continue on with the action that they proposed, and to present my position on why it is unethical, and also present the codes of ethics that have informed my thought process on it. Now, if the employer did not change their stance, the resolution did not occur, then I would have to decide if I was going to remain at the company and kind of deal with it or fight for change, or if I was going to leave the company. And if I was going to stay, then maybe I would meet with management up the chain about it, or look to fight for some policy change within the organization. Now, if I was leaving my counseling job at an agency for private practice, I would be obligated to tell my clients that I would no longer be providing services, and I would have to inform them on the transition process, who may be taking over their counseling, giving them all their options for treatment as I would be leaving. And I would have to be careful to not recruit or encourage any sort of jumping ship over to follow me. That would be unethical in multiple ways, as ethical codes point to self-referrals not being acceptable, and for recruiting through your current employer also as unethical. I would also want to be aware of non-compete agreements that may be in place and just work for the welfare of my client and not for my own personal gain. If I had a client that was not approved for further counseling services through insurance, but I felt that they really needed them, I would request additional services on behalf of the client. And if that request was denied, I would then file a complaint with the insurance company and also suggest to my client that they appeal that denial with the insurance company as well. And if the client was at risk of serious and foreseeable harm or danger or in crisis, I would continue to provide services until I was rest assured that they were being taken care of from either a mental health professional or a facility that offered proper mental health services.